Why is the government looking at stricter compliance measures? Just how significant is fraud in the scheme?
Yeah, Kath, as you say, this is part of the sweeping reforms to the NDIS announced by Minister Mark Butler on Wednesday. Essentially, data from the National Disability Insurance Agency suggests that between 6 and 10% of all payments to participants is spent on inflated invoices, organised crime or ineligible payments, which amounts to between $2.8 and $4.6 billion of waste per year, or about $6,500 per participant. Now, it should be said, most of the people on the scheme have no idea that they might be dealing with dodgy providers. But to that end, the government has said it will impose mandatory provider registration in a bid to try to standardise some of these practices and also eliminate the practice of these unscheduled reassessments that are occurring for 1 in 5 NDIS participants and result on average in a 20% increase in plan costs. There'll also be a move to limit what providers can charge for, what kind of services, and all of this is intended to provide better quality and oversight of what taxpayer money is being spent on. But there are significant concerns that the consequence for participants will be less choice, and advocates from within the disability sector, one group called Professionals Australia, representing allied health workers, say, this could cause a mass exodus of providers from the disability sector, people waiting up to 18 months currently for registration at a cost of between $3,000 and $12,000, arguing that's just not going to be possible for a lot of providers.
And Sarah, is there any more clarity around what kind of supports will be available for those who get moved off the scheme in 2028?
Yeah, that's right. So the government wants to reduce the number of participants by 160,000 people by 2030, asking the state and territory governments to provide community-based supports for people with lower level needs. Though there is a very public funding stoush now playing out between the states and the federal government about the fact that the states are saying this is cost shifting, essentially. Now, the New South Wales Premier, Chris Minns, was asked whether he believes his state can provide the same level and standard of service for people who get shifted off the scheme. This is what he said.
We have to be really frank with people. We can't offer at the state level the kinds of services that are being rolled out at the NDIS. And the reason for that is not because we're stingy or we don't want to do it, but we're full on and flat out providing emergency care at our hospitals and education and building houses and all the things that we're obligated to do at the state level.
Now, yesterday, the NDIS Minister, Mark Butler, gave an assurance that eligibility criteria will not change. People will not be kicked out of the NDIS until these community-based supports are up and running and there's confidence within the sector. The Prime Minister, though, did not go so far as to say that people will not be moved off the scheme. And we understand that the Federal Treasurer, Jim Chalmers, has written to his state and territory counterparts reminding them that these reforms could save state governments hundreds of millions of dollars. For example, the proposed reforms for New South Wales, the federal government thinks would save that state $890 million to the end of the decade.